Okay, we're back for the last segment of tonight's show. And if you're just tuning in, I'm very honored to have Kelly Adams, the CEO of Desert View Hospital, with me, talking about the upgrades the hospital has made. I've certainly noticed that as a practicing physician in communities since 1999 and before the hospital came here, and watching the hospital grow. I've been very impressed with what he has done for the hospital and actually for the community. Since he has come to office, and I can honestly say that, administrators and hospitals do come and go, but I do believe Kelly has made a huge impact for us as providers, as well as for, and I utilize the hospital as an independent practitioner. I'm not a healthcare partner that makes money by keeping people out of the hospital, and Southwest Medical and Senior Dimensions really uses the hospital, but there are some people out there that actually lose money when patients go to the hospital, and they try to keep patients out of the hospital. Now, I didn't mean that in a derogatory sense for healthcare partners, but that's part of the way they structure their game. But that being said, the hospital has grown, it has improved,
Yeah.
and one of the things we were talking about on break, Kelly mentioned this diagnosis-related group that started in 1983. That was the year that I became a resident. And I remember right up to January, I had about 22 patients in the hospital that I had to see. And people came to the hospital for a workup. They actually came to the hospital. If you felt bad, the doctor just put you in the hospital. And I remember just seeing people that weren't very sick. And then all of a sudden, after that, it was like the census went in half.
Yeah.
And people, you actually had to be sick to be in the hospital. And what the diagnosis-related group was, is that what the final diagnosis was at the end of your stay is what they paid. So that started a huge problem with discharge planning. Moving people out of the hospital sooner than what they needed to be because of economics, and that's very unfortunate. And Medicare never corrected that problem; they never did.
Yeah, I mean, historically, you're right on track. I mean, the average length of stay. We'll do a little healthcare economics here for a moment. The average length of stay back at that time was about six days, 6.5, maybe 7 days. Even the normal delivery was a 4-day stay. Maybe 5.
Stay in the hospital for 5 days after.
Yeah, I mean, now it's 24 hours or less.
Right.
Those types of things you're talking about kind of has driven the expectations. We expect, Americans just expect high quality of health care. Well, the expectations are costly. And the thing you talked about with respect to healthcare reform and tort reform, if I've got to do these preventative tests, there's a cost affixed, there's a cost associated with every one of those additional tests, and for fear of litigation.
Yep.
And you're right, if that is silenced or at least softened a little bit, the attorney community doesn't like to hear those types of things, but from a cost of health care, it drives your malpractice down, mine, and quite honestly, we kind of get a patient through even faster than what we're going through right now.
Right.
But the laws of the land dictate that our physicians do those preventative or those additional tests.
That we practice cover your ass medicine.
Yeah, that's right. CYA. That's what we.
CYA.
That's right. That's what we do. Yeah.
Probably use the expletive, but things have been said worse on the TV than I've said that. But in an anatomical
You're
term,
okay.
Cover your buttocks, right?
There you go. That's right. That's the one.
But it's unfortunate that exists. But even I, as a practitioner, are designed to think what the worst case scenario is, so that I can be one step ahead of the game and order the right tests so that. I'm not missing a cancer, or I'm not missing a heart attack, or I'm not missing something that's serious, which we should be anyway, but there's a thing that comes with experience. There's a thing that comes with a clinical diagnosis. You look at a patient, you say it could be this, and I'm not saying I'm perfect, I've missed things too, but to order the tests and do the things that basically make sure that the outcome is not the worst case scenario because you missed it.
Yeah.
That's what drives one of the drivers for healthcare, and costs, and obviously expectations that people were used to going to the hospital and getting.
They were.
Getting
The whole
royal
dynamics.
treatment.
The whole dynamic has changed, and we've seen in other communities, the Walgreens and the CVS's and others try to get into some urgent care, and
Oh, yeah.
and unfortunately they've not worked.
Right.
Because the mastering. This is not a very good phrase, but the mastering of the billing cycle and the throughput really has to reside with those that do it every day. Stick with your knitting. You've heard that phrase is something that healthcare needs to stay in healthcare, and when somebody else tries to pick that up, it's unfortunate it doesn't work out very well. And that's not a competitive thing. It's just we're taking care of patients' lives.
Right.
You have to know what you're doing.
Right. It's just like where's the old statement, which is, I don't ask the bank how to bank, and they don't tell me how to practice medicine.
There you go.
Right?
That's right. Yeah.
I think we have Donna or Anna. Are you on the line?
Yes, doctor. I've been in many hospitals basically all over the United States. And the one thing I found about Desert View when I was in there, everybody seemed to enjoy their job. People were laughing. They were whistling as they go up and down, and it was kind of like, boy, this is really nice, because in some hospitals you never find that.
Wow. Well, that's good. I'm happy. Thank you for that comment. It's one thing to bring in the equipment, the training, but to set that esprit de corps throughout the whole organization, it just takes time to do that.
Right.
And it's growing your staff, getting your right people in, and setting expectations.
Well, that's why I said you've done a great job.
Yeah.
So, I mean.
Well, thank you for saying that. But again, it's not all me. It's the team. I'm surrounded by just excellent professionals. They know how to administer. They know how to work with people. They know how to hire the right kinds of talent, and we go from there.
Yeah, but you raised the bar. You came in and raised the bar. I will say that. I mean, nothing against the previous administrators. I mean, they're very nice people, but you raised the bar, and by raising the bar, the expectations go higher, the service goes higher, and people are happier, especially when you got productive people. There's nothing worse that brings an organization down when you've got 3 productive people and 1 person they're covering for.
Yeah, exactly. Well, I'm delighted to hear Donna's comment there of, we want happy employees. We want those that enjoy their job. And when they're good at it, they enjoy it, as opposed to guessing. We're in a business I'm very strict about. We cannot guess.
Right.
Cannot. You can't guess.
No.
We can't make anything up.
I can rule out, but I can't guess.
Yeah, that's right. We can't. And so we require our employees to know, and if they don't know, let's get an answer.
Right.
And let's do it in a very positive, very patient-oriented way. That's important. And so I feel good hearing those comments.
Yeah. Anna, are you still on the phone? She hung up. Okay, well, thanks for those comments.
Well, that was a nice compliment.
It was.
Yeah.
It was a very good compliment. And certainly, every once in a while, I do have the opportunity to go to the hospital and see a patient. I don't make it there all the time. But, I can tell the same thing. I mean, you walk in there, and people are very, very happy to be there.
Well, we've changed even the admitting process in the front door. We've changed that process around. It's a little frustrating for those that have been there before, but it works from a compliance point of view, from a HIPAA point of view. We have to watch all the data. The front doors that have been in the lobby that you go down the hallway, those are now closed, and we're now required to have every visitor check in.
Oh, wow.
So that's part of the thing that we just introduced this last month in terms of, someone that needs to come in, who you're here to see. No longer are the days you can just come in and roam the halls. There's just,
we went from a small town to a little bit bigger town.
Yeah.
Okay.
And with that, with those requirements are greater expectations.
Yeah.
And so we have to meet those expectations and comply with all the things that are incumbent upon me as the CEO to make sure happen in a hospital.
Right. Well, and like I said,
and let me say this real quick. I probably cut you off. Is the community has accepted those quite well. There's been a couple that kind of groused about a little bit, but once they understood why, they go, oh, okay, I get it. I'm accepting, but put me down. I'm here to see, Mary and Billy Bob, let's go down and see them.
Right. Well, and it's for their safety, and it's for the patient's safety, and
It is. Yeah.
we could go on days about what the community and the world we live in, and Pahrump has been very, I would say, somewhat secluded from the harshness of the realities of some of the bigger towns. But
yeah, there's some kind of a bubble around here, and I think people enjoy that.
Right.
I think they've created that for a while, and it's still kind of there.
But it can change in a heartbeat, and you don't want to be the center of news if it changes bad. I think
Right,
that's
right.
a very good move that you
Yeah,
did. That's,
yeah.
I mean, and it is important for patients to realize too that there are sick people in the hospital in there, and with one of the things I've talked about, on the show, some of the serious illnesses that are out there, some of the communicable diseases. You want to make sure that the right people are going in and things are done correctly. You don't want to take unnecessary chances with your life or some other patient's life because of just roaming the halls, and you want to make sure that the people there are there. And I think we had to lock our doors in our office. I mean, we had the unfortunate occurrence that, we were like that, and somebody walked through the back to use the bathroom and actually stole a phone and some money out of one of the practitioner's office. And that's never happened to us before. But that's the world we live in. And
well, we've gone to a no smoking campus, as you know, this past started in May, and that's gone over fairly well.
Yep.
We were just getting some non-compliant patients that were, again, leaving the back door open. If we maybe think about it, and now if that patient leaves to go outside, we can't let them back in. They've got to go around to the ER and go through the admitting process. That's right.
Yeah.
And most of our patients, honestly, are very good. They're understanding. They get it.
Yeah.
I'm impressed. And I think I told you at one of our dinner meetings once that the thing that I didn't anticipate is the attribute of caring. People care in this town. I didn't anticipate that. I'm very pleased.
Yeah, and really, in reality, I mean, narrowing the choices really is kind of a safety net for a lot of people.
It is.
But we are getting ready to run out of time tonight, and I want to thank you very much for coming in and spending your evening
Thank you, Dr. Reiner.
with me and the town of Pahrump and telling us what's been going on in the hospital. And I'm not just saying it. You've done a great job for the hospital, and I enjoy having you on the show. And
well, thank you.
Thank you.
This
We'll
is
do
a
it
treat.
again.
Thank you for the invitation to be here.
We'll do it
You have a
again
great
pretty
show.
soon. You will. Thank you. All right, Pahrump, thank you very much for tuning in tonight. We'll see you next week.